diabetes and have been prescribed insulin to take via an insulin pen, there are a few things that you should know. There are many kinds of insulin, and your doctor will decide what insulin type, amount, and injection times are best for you. It's understandable if you're feeling a little nervous or anxious about taking insulin injections. But with a little practice, you will see that it takes only a few seconds to do and can be rather easy. To ease any anxiety you might have about taking insulin injections, we will demonstrate how to take an insulin injection using an insulin pen. Now, let's begin. First, start by washing your hands with some soap and water. Prepare the insulin supplies and make sure you have the following items: the insulin pen, alcohol swab or cotton ball moistened with alcohol, and a new insulin pen needle. Prepare the insulin pen. Always remember to check the label and the color of the insulin pen. Remove the cover of the pen. Take your alcohol swab and wipe the tip of the pen where the needle will attach. Some insulin pens, like NPH or mixed 70-30 or 50-50 insulin, will need to be gently mixed before use. These types of insulin look cloudy or milky white and need to be gently mixed by rolling the pen between your palms. If you're using a different type of insulin that looks clear like this one, you do not need to mix it. Only the cloudy insulin needs to be rolled. Take a new pen needle and remove the protective tab. Insert the needle into your pen and screw it on until it is secured. Now you want to prime the pen, which means removing air from any of the needles. We do that by dialing the pen 2 units, then remove the needle cover. Point the needle up into the air, tap on the side of the pen, and then press down on the knob. By doing this, you've primed the pen and made sure that insulin is going through the needle. Set the pen to your dose. Turn the knob until you see the correct dosage. Now it's time to choose an injection site. Insulin can be injected into any of the following sites. The stomach. This is the preferred injection site. Stay at least 2 inches away from the belly button or any scars that you might have. You can inject insulin into the fatty tissue at the back of the arm, or the top and outer area of the thigh, or the upper and outer part of the buttocks. Remember, the insulin needle goes under the skin only, not into the muscle like the flu shot, for example. Insulin injections in general are easier than intramuscular injections. Avoid injecting cold insulin, since this can cause discomfort. When using the insulin pen or vial for the first time, take it out of the fridge at least 30 minutes before injecting so it has time to warm up. Rotate the injection sites to use a slightly different spot with each injection, and avoid injecting insulin into scar tissues or hard lumps that you may have. Insulin might not be absorbed as well if injected into these areas. Injecting into the same spot too often can cause hard lumps under the skin and can impair insulin absorption. You can rotate the injection sites in a pattern that works for you. Examples of rotation patterns are shown here. Once you have chosen your injection site, wipe it down with alcohol to make sure that it's clean. Now you are ready to inject the insulin. Gently pinch the skin with your free hand and quickly insert the needle at a 90-degree angle. Release the pinch, push down on the plunger at a steady motion for about 10 seconds until the pen goes back to 0. Pull the needle straight out of the skin. Now that you have taken your injection, you need to safely dispose of the pen needle or syringe. FDA-cleared sharps disposal containers are generally available through pharmacies, medical supply companies, healthcare providers, and online. If an FDA-cleared container is not available, some organizations and community guidelines recommend using a heavy-duty plastic household container as an alternative. The container should be leak-resistant, remain upright during use, and have a tight-fitting, puncture-resistant lid, such as a plastic laundry detergent container. All Sharps disposal containers should be labeled to warn of any hazardous waste inside of them. Follow your community guidelines for proper disposal methods. You should always store unused insulin pens in the refrigerator at a temperature of about 40 degrees Fahrenheit or 4.4 degrees Celsius. Insulin pens can be used, if refrigerated, until the expiration date that's listed on them. It's likely that you bought more than one insulin pen at a time. You should store all extra insulin pens in the refrigerator, except for the one that you are currently using. Remember, do not freeze insulin or keep the insulin near ice. Do not keep insulin in a hot place, warmer than 86 degrees Fahrenheit or 30 degrees Celsius, or in direct sunlight. Do not use the insulin after the expiration date printed on the pen. You can keep the insulin pen that you're currently using at room temperature, below 86 degrees Fahrenheit or 30 degrees Celsius, for up to 8 weeks. The number of days or weeks depends on which pen that you use. Congratulations! You've just learned how to inject and store insulin. Taking insulin injections can be a very simple process, and the more you do it, the easier it becomes. If you'd like to learn how to take an injection using a syringe and vial, please watch the next video.